Welcome back, everybody. March is Colon Cancer Awareness Month.
We are pleased to be joined by Dr. William Polk of TriStar Centennial with more on some things you should keep in mind. Dr. Polk, thanks for being here with us today.
Thank you.
It's important to get a colonoscopy, to get checked for this.
I would agree.
Yeah.
Colon cancer is, depending on who you talk to, the third or fourth most common cancer, and it's the #2 cancer killer. And it's largely a preventable disease by having your colon screened for first polyps and then cancer.
And Dr. Polk, so why are these screenings not happening, in your opinion?
Well, I think that obviously, the pandemic has played a large role in this. I think that we see two things. We see both on the screening side that there's been a decrease in the number of colonoscopies done. There's been a decrease in the number of patients making visits to their physicians. I think just fear from coming to the hospital and fear of exposure. I think that the bottom line is the hospital, as far as I can tell, is the safest place that I visit with any regularity, just all the measures that are taken.
And
I think the other thing...
Go ahead.
Yeah, I think the other thing that we see, in addition to people not seeking screening, is people that have postponed evaluation of new symptoms. Blood under bowel movements, change in bowel habits, abdominal pain. In my practice, anecdotally, these have been the biggest issues that I've run into, where people have presented later than I think they normally would with malignancies where they just have postponed being evaluated.
And it's doubly important if you have a family history, correct?
Correct. If you have a first-degree relative, either a brother, sister, or a parent that has had a colon cancer, you should have a colonoscopy done by age 40 or 10 years before the very first presentation of malignancy in your family member. So if you had somebody that had a cancer at 45, you should have a colonoscopy by the age of 35.
All right, Dr. Polk, thank you so much for your time this morning. We sincerely appreciate you sharing your insight with us, sir.
Thank you very much.